it's such a pleasure to be here. This is my first HRS conference, and so I'm excited. I thank you so much for the invite, and I look forward to going over rabbit health, newest treatment protocols, and time-tested effective ones, plus current thoughts on the subluxal and cuniculi. It's good that they gave me an hour and a half because I think that's a lot. That's the largest topic I've ever lectured on, and there's a lot to cover with that. And so what I thought I would do is kind of focus on 3 common conditions, talk about what we've done in the past, what has worked, and what's in the future, what's on the horizon, what do we have to look forward to. And so that's kind of what I want to do today. I'm not checking my voicemail or my text messages. I'm trying to use this technology to advance through the slides. And so it worked great, but then you don't use it for a bit, and now it's having a little bit of problem. So give me just a second real quick to do this. How's everybody doing today? No, I have lectured before, really. Okay, so I think we're good. It just kind of decided to give up here, but we're back live. And so I just wanted again to kind of say thank you. But I have my notes here, so I can cheat a little bit. So I don't want to forget anything. There's again kind of a lot to cover, and so let's go ahead. Timing was perfect for this. So I just got back last month from the huge exotics conference in Dallas. This is one where the AEMV is the Association of Exotic Mammal Veterinarians. It's the group that focuses on their medicine on ferrets and rabbits and rodents, and really has done a lot to elevate our practice. So, exotic animal medicine kind of started out, shooting from the hip and just, trying to help things without a whole lot of data or research. And we kind of, we haven't really tolerated that for very long. We wanted to, practice sound medicine and do things that are working and do things for a reason. And this group, the AEMV, is one of the kind of the founders to really push us to the next level with rabbit medicine. So if you're not familiar with them, they do have some educational stuff for the non-veterinarians. They have a great resource to find rabbit veterinarians if you're going traveling or you're going to a new area. This is where I usually direct people to or to the house rabbit societies of the area, but it's a great resource of vets that are at least have a strong interest in rabbits. And then a final shout out to Colorado House Rabbit Society. I've known Nancy for 21 years now. So I first met her in 1996 when I was a lowly veterinary assistant, and here she comes with all her bunnies. And she's the one that planted the seed for why rabbits are such an amazing creature, and really is the reason I'm here. So thank you so much, Nancy. We've made it to 21 years of a relationship. I think our relationship is legally able to drink now, which I'm looking forward to. So yeah, thank you for the invitation, and thank you for the opportunity. As I said in the introduction, I also have a strong fondness for cycling, and I wouldn't call myself an avid cyclist. I consider myself a recreational cyclist. But it's something I really love to do when I'm not practicing veterinary medicine and taking care of rabbits. I kind of had to laugh a little bit about the free time thing, because free time for me is a little bit hard to come by. But I use this as an excuse to get out and do something else that I love and to stay in shape. But why is this slide here? So here I am talking about rabbit health, and now am I doing a pitch for PACE? No, I'm not. I put this up here because it reminds me something important to say to you, and that is, we get a group of veterinarians that come and they have, this anxiety about riding the French Alps. These are the climbs that you see in the Tour de France, and you know how hard they are, and you've never done them before, and you go there with this anxiety. And we you know, we take away that, we give them an opportunity to challenge themselves and succeed. And it's you know, yes, it's great countryside and you know, lots of wine and lots of fun lectures, but it's really watching these people kind of develop into facing the adversity and kind of taking that challenge and accepting it. And you may not always succeed, right? And so sometimes failure's, you know, not the opposite of success. It's, you know, it's an opportunity to kind of continue to advance yourself. And so this is where, you know, you are, you know, you challenge yourself. You basically say, you know, don't let the challenge turn you away from trying. And that's the topic of this lecture, right? So this is, we're talking about advancing rabbit health, and the way we have advanced that is not by saying, well, there's nothing we can do, you know, this is the way it's always been and this is the way it is. We challenge ourselves, we take on those, you know, those bad diseases, and we say we can do better. You know, what can we do? So, you know, why do we want to do better? That should be obvious, right? So this is not something we want to settle in and be complacent about. You know, this is how, you know, I just kind of went on the web and kind of picked some of these pictures from old timesy medicine, and you know, we're developing new medications all the time. You know, we don't want to settle for, you know, these. This one cracked me up. This Dr. Batty's asthma cigarettes. I'll read it since it's kind of small, but it basically says, for the temporary relief of, you know, asthma, and it kind of lists all these things, but at the very, very bottom it says, not recommended for children under 6. So no asthma cigarettes for the children under 6. You know, that's unacceptable. And then this little guy here, you know, I don't honestly know if that's like a biohazard suit, but I thought he looked kind of rabbit-like, you know, and you know, I don't know who was in charge of design for some of those suits from that day. You know, what's the purpose of those little flaps? I don't know. I think they just did it just for fun. But veterinary medicine is dynamic, right? It's always changing, and that's great. I mean, that's one of the things I love about being a veterinarian is and being a rabbit veterinarian is we're constantly learning, we're constantly doing things better. You know, I always say that we're striving to do things less bad all the time. And so that's, you know, kind of where we're going to go today is what are we doing? You know, what are we talking about? A lot of these conditions we kind of covered yesterday, and so we're going to get some repeat stuff, which is good. You get to hear it from a different angle. But I want to hear from the audience here, you know, so things that we talked about. Can you guys name me 3 common conditions? So when you think about
GI stasis.
GI stasis, right? So you know, Dr. said yesterday, you know, the top 3 were GI stasis, GI stasis, GI stasis. I love that because it's so true. We see, you know, a lot of GI stasis in these guys. Anybody else? Dental disease. So this is one, you know, you know, common conditions, common presentations, more dental disease than pretty much any other, you know, any other problems in our rabbits, and that's, you know, I would certainly agree with that assessment. Any last ones that are?
Head tilt.
EC, head tilt. We can kind of put those in the same category. That's already a given, right? That's in the title, so we're gonna skip that. Upper respiratory is very common. Abscess, ear infection, injury, old rabbits. We talked about it yesterday. We talked about that yesterday, yep. These are all great, by the way. So intact female does. Yeah, we got cancer. Cancer, yay, cancer. So those are the 3. Great job. You know, we kind of forget that one a little bit. You know, maybe it's not as common, but it's getting more and more common, and there's some stuff out there that I want to touch on. I also threw in pododermatitis, mostly because of a recent case I've had, and I want to, if we have time, I want to talk about that. That's the hot sores in these guys, and then, like we said in the title, we're going to talk about EC. So those are the 3 right there. You know, we always kind of go more than we need to. So let's jump right in. You know, GI stasis. This is a symptom, right? It's not a disease. There's lots of things that cause it. Anything that causes pain or causes anxiety or stress, or, you know, whether that be physical or emotional, that, you know, these guys, you know, their gut can turn off in a moment's notice. So that's, you know, that's one of the characteristics of this. The other thing is that it can be life-threatening. So these are the ones that, you know, happy, hopping, eating rabbit, within 24 hours of being stasis, it can be life-threatening problem. So it's something that we really need to take into consideration. And then I always tell owners that, you know, if you've had a rabbit that has had stasis in the past, it's more prone to develop it in the future. So it's like these sensitive stomach kind of, you know that's the default response. And so, you know, that's something that we always, you know, kind of caution owners that have had rabbits that have had these, you know, symptoms in the past. So that's kind of terrifying, right? So we have, you know, a disease, or it's not a disease, it's a symptom. We have a condition that literally anything and everything can cause. It can be life-threatening, and it can happen over and over and over again. So, you know, we lose sleep over this, right? And rightfully so. And House Rabbit does an amazing job at educating owners that, you know, this is something that we really need to be concerned about. So, you know, dogs and cats, okay, we're on day 3, we're not eating, maybe we should see what's going on. You know, rabbit turns their nose at their, you know, papaya tree. It's like, what's going on? We gotta figure this out now. And so that's good. So we've gotten better at, one, being concerned, recognizing it, and managing the symptoms. So, but what have we done in the past? You know, so let's go back to the good old days of pineapple juice, right? Hopefully we're not doing this anymore. You know, this was something that, it's one of the, you know, we've kind of come up with things that usually don't cause much harm, but we don't know how much it's helping. This one was probably causing more harm than it was helping. So, you know, we know that pineapple juice has a lot of simple sugars in it, and, you know, that selects for bacteria that can be gas producing and kind of perpetuate that problem. So hopefully we're not forcing pineapple juice down these guys to try to get things to move. Mineral oil, not motor oil, but mineral oil. So this is, you know, taken from our friends, the horses, the big rabbits that are out there. You know, they get colic and they get abdominal pain, and they, you know, we would put a tube up their nose to their stomach and basically fill them with mineral oil to kind of help move things and get things going. You know, the benefit of that in rabbits, I don't think was ever really proven. I think a lot of these guys, certainly the stress of trying to get them to get that mineral down was high. The risk of aspiration, of breathing it in the airway was high. And so it's one that, because of the difficulty of it, we hopefully, and the lack of benefit, we're hopefully not doing that one anymore. And then surgery, hopefully none of you guys are doing surgery, unless you're a veterinarian, but this was one that we, you know, we go, here's a rabbit not eating, low temperature, took an x-ray, something's, you know, there. We go in surgically, we remove hair out of the stomach, we sew them up, we close them up, we say, hey, we fixed this guy, there was hair there, and now it's gone, and the rabbit, you know, honestly, with those, you know, those surgeries, about 50% success rate, so that's not good for surgery. What we've come to realize is hair is normal in the rabbit stomach. So, you know, going in and removing it really didn't do a whole lot of anything, but why we saw success in 50% of the cases was probably more related to hydrating, pain control that was associated with the surgery itself versus actually going in and removing the hair. So we did talk you know, quite a bit about what we do yesterday with stasis bunnies. I can't overemphasize hydration. So this is something that, you know, stuff in the GI tract kind of hang out, and the body says absorb as much fluid out of there as you possibly can. And when they're dehydrated, they're slowing that GI transit and trying to get as much of that fluid out as they possibly can. And you know, not only that, but dehydration itself just kind of makes them feel kind of puny and punky. And so we want to kind of correct that. I tell people to think about a kitchen sponge in the shape of a cylinder, you know, and how it would be to kind of push things through that with it dry. You know, it's not really giving much to expand. It's hard, it's crunchy. Now we soak that in water, and now all of a sudden we can kind of push things through there. It's supple, it stretches. It's kind of the same idea with hydration. So that the better hydrated they are, it's something that's going to help kind of get things moving. these guys are painful, so this is a comment I just pulled off that said, I'm afraid it's worse than tendonitis, Mr. Tufnell, it's 11-dinitis. So these guys are hurting, they're bloated, the last thing they want to do is start eating again, and so we have to manage that pain, we have to treat that pain to keep that gut going. And then, as was touched on yesterday, fiber, so it's the bottle brush of the GI system that pushes things through. It feeds the bacteria of the hind gut to create that, that beneficial bacteria that aids in digestion. So fiber's a big one. But occasionally, that doesn't work, right? So we have these guys that we do this and we manage their pain, we hydrate them, we give them fiber, and their temperature's not coming up, and what's going on with those, and what do we have available to do? And this is an X-ray, that's showing a very dilated stomach. It's taking about half that, abdominal space. There's a lot of gas in there. When we see this on X-ray, we kind of shudder a little bit. So this is what's typical of what's called a gastric outflow obstruction. So something is basically blocking that stomach's ability to empty and move things through. And we know that rabbits are unable to vomit, and that's a life-threatening emergency. So that, something, we need to do something about that right away. And typically, this is the rabbits that we would take to surgery, right? So we would see this and say, we're not going to stabilize him. We're not going to, get him to a better surgical plane. We need to go in and we need to, relieve that obstruction if they have any chance of surviving. And we go in, and I would say, GI stasis, very, very common. GI outflow obstruction, not very common. I would say I saw a handful the first 10 years in practice. So, I'd always tell people, don't jump to this because it's not something that we see a whole lot of. But I will say we're seeing more and more of it. I don't know why that is, if we're getting better at diagnostics or we're truly seeing more, but I've seen probably 10 in the last year with this. And so it's something that we're unfortunately seeing more and more common. So we go in surgically. 90% of the time what I do is I remove a hair that's wadded up about the size of an M&M, maybe smaller, that's in the duodenum. So it's right outside the stomach, right in the first section of small intestine, and it's, basically there's a lot of bruising of the tissue that's there, and go in, we remove it, we suture them up, and they recover. The success rate of that surgery is probably about 70%. These guys are pretty critical going under, and so it's something that, it's touch and go during the procedure, but it's something that, that's how we handled it in the past. So what's new? What's on the horizon? How are we going to treat this? What's different about this? This problem. So one case I had was a rabbit that was temperature was 93, obtunded, meaning not really responding to his environment. He was in, I had very real concern that inducing this guy would push him over the edge, meaning just starting the anesthesia would basically, we would be in a bad place. So I called a friend of mine who was a specialist and kind of said, hey, I have this rabbit that, this is what's going on. And she said, why don't you just decompress the stomach? Why don't you just go in there and, relieve all that gas and kind of help out that way. Okay, that makes sense. I'll decompress and then we'll kind of stabilize and then go in surgery. And she's like, no, you don't have to open these guys up. You can just decompress them, give them fluids, give them pain meds, and they'll do well sometimes. And I said, okay, and hung up the phone, thinking in my brain that there's no way. The problem is we have an obstruction. Sure, you can treat some of the symptoms and relieve some of that distension, but it's not going to fix it. It's not going to cure it unless you go in and remove that obstruction. So I have to say I went at it pretty skeptical, but I didn't have much of a choice. So I took it's called a red rubber catheter. It's basically a little silicone tube, and I punctured a bunch of holes in it because the stuff that's in that stomach it's kind of like grass soup, so it's a lot of fluid, critical care, and things like that are kind of floating around in there. And if you just pass a single tube, it clogs within a second. And so I kind of created a tube that has, you know, lots of little holes, so if a couple get clogged, you can still continue to drain some of that fluid out. And I pulled out about 250 mils of fluid and kind of emptied that stomach out. Yeah, it's quite gratifying. It's like popping zits and abscesses. So you get in there and I've done something, right? And then I kind of waited for it to be a problem again and see how, you know, how's this guy doing? You know, should I go in surgically? Is this going to really, become a problem? Which I expected, and it never did. He did amazing. And so, you know, why is that? You know, why are these guys recovering without actually removing the obstruction? And the thought is that when we go in, it's not a huge piece of blockage, and so the pressure that's kind of built up behind, that's constantly, you know, there, may be part of the problem. And so if we remove that pressure and hydrate, we can get it to move downstream. And I've seen this on necropsies with these guys where, you know, the insult has already happened, there's evidence there was an obstruction, there's bruising that was there, but I don't find the actual, you know, ball of hair until I go down the intestines further. So sometimes just, you know, kind of relieving that pressure will get this to move. And I've done this probably about 6 other times since I first heard, and I would say I have about an 80% success rate. Some of them will need multiple decompressions, so we'll have to go in there and basically empty it out and then do it again while we're keeping them on fluids. But I would say where it benefits us is it's, you know, we're not having the expense of doing a major abdominal surgery. We're not having the risk of the anesthesia that's there. A lot of times these guys are so out of it that we're not anesthetizing, we're just placing an oral gastric tube. We're placing a tube right from the mouth right into the stomach, which they tolerate quite well. And they, you know, it's the trauma of surgery is avoided as well, so they don't have all that healing that has to happen because we went in and went into the stomach. So I think it's going to take a lot of convincing, you know. So like me, I was, you know, it didn't make sense. I was a little bit reluctant to believe that, you know, something like that. It sounded a little bit like quackery, and if I didn't respect the person who told me, I don't think I would have done it, to be fair. And so this is something that it's going to take a while for word to get out. But I do think and is it going to help every single bunny? No. But is it worth a try to either stabilize or even solve the problem with the gastric outflow? Absolutely. I think this is something that needs to happen for all these guys that have this, you know, just at least an attempt before surgery is considered. Also working with Jorvet and things like that to kind of come up with tubes specifically for this reason, so that we don't have to, you know, kind of make our own and have them ready so when we go in. So it's it's something exciting, hopefully something different, hopefully something that really helps these guys out. Dental disease, So there's our malocclusion, those, you know, continuously growing teeth, growing 2 to 2.4 millimeters a week, nonstop. If they don't line up, if there's metabolic bone disease, if there's, you know, poor diet, you know, with hay, it's just something that kind of continues to be a problem. You know, we have these small mouths, they can't open very far, it's hard to see, you know, it's hard to get instruments in there to do stuff about. Excuse me. You know, we're selecting for these rabbits that have short noses and fuzzy heads and little ears and horrible mouths. And so, you know, that's, you know, part of the problem that's there. Rabbits also have this kind of innate ability to wall off infections, right? So they form these really thick capsules around the abscesses. And, you know, when have you seen a rabbit with dental disease with a fever? You know, they don't have a systemic response typically. You look at their white cells and they're normal. They're not really developing any kind of immune reaction against this abscess. They're just kind of producing pus. And it's, you know, and actually I take that back. We have seen rabbits develop, you know, fevers with abscesses. Usually that's a poor prognostic indicator. But it's one of the reasons why we see, I think, dental disease in these guys is just their ability to, you know, to wall that infection off while it continues to develop and continues to be a problem. And it's always progressive, or almost always progressive, meaning when we go in and we start managing these guys by pulling teeth and trimming, usually there's some form of maintenance that's involved. So these are guys that need trimming every 3 months, 6 months, 12 months, more teeth pulled, that sort of thing. So I always, this is not a cure. This is a long-term management. We've done a lot to slow the progression, but we will never say, your rabbit is cured of dental disease. So what did we do in the past? We would treat it like a dog or cat. We would lance it, flush it, and say, there you go. And they would come back in 2 weeks with it healed over and abscess formed, and we realized we weren't doing a whole lot of help with that technique. This is a rabbit with pretty advanced dental disease. You can see there's an abscess that's kind of eaten away the entire jaw. We do this view, it's called the oblique view, where we kind of rotate that head 30 degrees. It allows us to separate the left and right jaw, so we can kind of assess it separate. But that's pretty bad disease. You lance that and you flush it out. That's not going to do the rabbit a lick of good. So we would do antibiotics. So we would we put them on long-term antibiotics, and maybe it would slow the progression down. But it's not it's not great for for microbial resistance. We're having these guys on antibiotics long-term that we're kind of selecting for bacteria that's now becoming more and more resistant, and that's becoming a real problem not only in rabbit medicine but human medicine as well. So you can kind of see that loss of the bone around the roots. Does that look a little different to you guys?
Yep.
See? So that's not a rabbit, right? Does anybody know what that is? It's a human. Does anybody know who that is? It's me, yeah. So I had that tooth pulled on Wednesday, so it was a fracture, probably from cycling, that was missed, right? So I went to my dentist and said, my jaw really hurts. And they said, oh, you're grinding your teeth, you need a night guard. And I tried that for a month, 2 months. They took another x-ray and saw a little bit of that and said, oh, you need a root canal. And I went and had a CT done, and they said, you need a tooth pulled. It's too late for a root canal. So they have problems in human medicine too, but we're trying to get better at recognizing. So what do I find works with dental abscesses? Marsupialization, so making a pouch. We learned yesterday that 96% of the bacteria that cause dental abscesses are obligate anaerobes. That means they die in the presence of oxygen. So let's use that to our advantage. Let's open that abscess up and let's let oxygen in and work as an antibiotic and let that heal slowly over time to decrease the likelihood of it coming back. And the reason we can go this route is because you guys are great. This is not easy post-operative care, right? There's some maintenance involved here. You have to kind of, get rid of that gross factor and get in there, debride, and they're still producing pus, and you're still cleaning it out, you're flushing it and putting your Silvadene on there. And so there's a lot of maintenance that's involved after, and it's certainly not for any owner. But I will say that we're working with the House Rabbit Society. There's so many more owners now that we have this available, that they can do sucking fluids, that they can go in and kind of debride these. And you kind of always caution them before you go in the room after the surgery with the rabbit and say, now look, there's going to be a big hole in the face, and so kind of be ready for it. But that has worked, and there's still some of those rabbits that are very strong healers, and so you do this, you marsupialize, you leave the pouch, you come back in 2 weeks, and it's completely gone. It's healed over, and then 2 months later, there's more pus that's forming in there. So, and there's a beautiful view of the mountains right there. All right, I'm talking too long, I'm sorry. So we've gone to acrylic beads. So this is the PMMA, the polymethyl methacrylate beads. These are beads that we impregnate with antibiotics. We put them in the abscess, and then we close the abscess. And what that does is it slowly releases antibiotics and hopefully kind of keeps things from occurring. I will say it depends on the antibiotic that you chose and whether the bacteria is sensitive or not. And you know, you don't have that luxury of waiting for the culture results sometimes. You know, it's something that you have to kind of, you know, go in surgically and put the beads before you know what it is with that. And it's helped a lot, you know, so these guys, you know, if you chose the right antibiotic, you know, you can see resolution with the antimicrobial beads. Sometimes it doesn't work. Sometimes they react to the acrylic. Sometimes it doesn't seem to have any effect at all. Sometimes they develop fistulas or open draining tracts and things like that. And so, you know, what are we doing different with dental disease? What are we doing that might help these guys out and work better than what we've done in the past? And one of the things I'm doing is I'm actually infusing here. I didn't get many pictures of the actual acrylic beads, so I went with acrylic nails and I have to do some but this is what we're doing is we're actually, after we take care of the abscess, after we debride it, after we remove the affected tooth, we're filling the cavity with the acrylic. So we're actually making the acrylic during the procedure and actually kind of forming the acrylic to the cavity of where the abscess was. Where this has really, really helped are those rabbits with end-stage dental disease with maxillary abscesses. So those upper cheek teeth that you pull, and now you have this big cavity that is hard to manage. They get food stuck up in there, you have to rinse it out. Initially I tried this with an oral gel that was made for having antibiotics. You pull the tooth and you fill the root space with the gel. That never worked for rabbits. I tried that twice and it was a failure pretty quickly with rabbits. I think it's just because they chew so much and gel just does not have the ability to stay where you put it when you're chewing like that. So the acrylic, you know, we would infuse it, and I've had a couple that have been out over a year that have done very, very well. So it basically, especially in the upper cheek teeth, it fills that cavity, it prevents food from getting in there, it has antibiotics, so it helps kind of control the infection, and it's something that is pretty simple and easy to do. The hard part is getting the tooth out and removing all the pus, but once you get that taken care of, filling these guys with the acrylic seems to be very well tolerated and helps these guys do quite well. Also talking about CT, so we mentioned that a little bit yesterday. So nope, that's not a rabbit, and I apologize. I don't know how he got in here. It's more for the actual device that's there. So that's called a mouse trap. And one of the things that was presented at the conference that I went to last month was from Dr. Richardson from the University of Edinburgh, and she did over 200 CTs on rabbits with this device, she had to sedate or anesthetize only 20% of those rabbits. So this little thing is something that's allowing us to do CTs without sedation, without anesthesia. So it makes it less expensive and safer and things like that. The CTs that are out there now, it's incredible what they're giving to us. So we have these, the micro CTs that, give us these insane 3D images. They can do a 512 slice image in 18 seconds. I mean, so that's how quick these things are. So we're seeing more of them. Some private practices are having CTs in their, in their hospitals. The universities are getting more easier to manage to kind of send cases up. We have Colorado State University. They have a scanner, and they'll do with basically the entire skull, and it roughly runs about $500, which is a lot, right? But 5 years ago, it was probably about $1,700. So they're coming down quite a bit. They're getting better as far as the speed of acquiring the image. They're getting better at the quality of the image, and it allows us to find these these little bitty abscesses at the root, or kind of know how many teeth are affected, finds things in the inner ear or middle ear that may be causing some neurologic stuff. It really has, it's helped us a lot. So there's still, a lot of veterinarians that are afraid to go this route because we were taught that, it is so expensive and you know, it's anesthesia, and so we don't offer it. But now you guys can talk to your vets and say, what about a CT? And see what, you know, see what they're running as far as costs, and see what they're doing as far as anesthesia, and allowing us to really get, you know, better images to find out where the real problem is, and how do we tackle it. So that's, you know, that's something that's out there that we're, you know, that I think is going to be very promising and helping us manage these guys better. I have a rabbit in the hospital now that we just, you know, inside the mouth looks great, x-rays look great, but continuing to develop an abscess that I went into from the outside and wasn't able to, I mean, I couldn't find it associated with the jaw, couldn't find it, I knew it was a tooth, but I didn't know which tooth it was. And x-ray wasn't helping us. And sent them up for the CT scan, and of course it's the you know, the fourth tooth on the lower side, which is like the hardest one to get to, with the longest root, and completely healthy except for the tip of the root. So it's one that is, you know, we're working on getting that one out, but I wouldn't have known it if we didn't have the CT to tell us which, you know, which tooth it was. We don't like just pulling teeth at random. All right, cancer, the big C, right? So this is one that, you know, unfortunately we're seeing more, but fortunately it's because our rabbits are living longer. So it's a little bit of a double-edged sword there. So, but that doesn't mean we're helpless. We can, you know, figure out ways to manage and treat and take care of these guys. Before going into that, I wanted to talk a little bit about nomenclature, because we throw these words around. Sometimes we don't really know what the meanings are, and sometimes we don't clarify that. So I just wanted to touch a little bit about the basics. So when we say tumor, it literally means swelling. That's it. So when I give fluids, sub-Q on a rabbit, I'm creating a tumor. Hopefully that tumor is gone in an hour or two, but that, you know, swelling in the body is a tumor. We've kind of absconded that term and kind of pulled it down into the next level, which is neoplasm. So a lot of times when you hear the word tumor, they're referring to a neoplasm, which is just a newly formed tissue, right? So it's a newly formed tissue that's forming this, you know, this neoplasm. It doesn't say anything about, you know, is it benign, is it malignant? That's kind of reserved for cancer. So when we say the word cancer, we're referring to a malignant neoplasm or malignant tumor. And what does that mean? That just means it can be either locally aggressive, so it can grow these really fine little, you know, tentacles down deep into the tissue, so when you go in and you surgically excise it, it has a high chance of coming back if you don't get wide enough margins. It also has a possibility of traveling, right? So these are the ones that can go to lungs or liver or lymph node or, you know, anywhere really. And so that's what makes a cancer malignant. You know, rabbits are living longer, which is great, like I said. You know, and that's why we're seeing those. What have we done in the past? We talked about yesterday, preventative spaying. You know, the big study that gets talked about is in the 50s, there was a group of rabbits. It was a fairly large group, and about 79.1% of them had uterine masses. We don't know if, you know, what those tumors were, but it was a pretty high incidence of what we kind of then took that information, said 80% of, you know, does over 5 have a chance of uterine adenocarcinoma, which is, you know, there's definitely a very high risk of adenocarcinoma, and it's a good, you know, good piece of information to educate owners about, and why you should spay and neuter your rabbits. I get these clients sometimes, not very much, but you know, they'll come in and say, you know, I want to neuter the male because it's cheaper, right? And so, but I don't want to do the female. And using this information, we can educate them and say, well, you know, it's actually, you should spay and neuter both of them, because I can't imagine having, a spayed female and an intact male, and I can't imagine, you know, not spaying your female rabbit and risking the uterine adenocarcinoma for those guys. So, you know, preventative spaying is where we want to go. Chemotherapy, you know, so that one's a little bit touchy, right? So we don't do a lot of chemotherapy in rabbits. And they just, you know, there's not a lot of stuff out there that shows us that it really helps. and a lot of times the treatment can be worse than the disease. There is, steroids, right? So prednisolone, which is one that we go to. Some may shudder at the thought of giving steroids to a rabbit. We've kind of swung the pendulum back a little bit. So when we started, when I was going through vet school, it was never, never, never give steroids to a rabbit because they're steroid sensitive. And one dose can cause kidney failure, or infection or whatever. Even topical eye drops with steroids in them can cause problems. And that's true. So, rabbits are definitely steroid sensitive. So it should never be, oh yeah, let's try steroids and see what happens. It should be an educated decision as far as there's a reason to give steroids, and we know what the risks are, but we're still deciding that it's the benefits outweigh the risk. So prednisolone, this is a CT actually of rabbit chest. You can see the heart in the center there, and then that mediastinal mass, which is probably a thymoma, which we talked a little bit about yesterday. Certainly surgery, if you can find a vet that's comfortable going into a chest and removing that. Radiation, certainly we've seen some papers that show that they do quite well with radiation with these tumors. But that's not always an option for clients, right? So radiation, there's quite a bit of cost involved. Certainly surgery, there's quite a bit of cost and risk involved. And so there was another presentation at the conference last month that talked about long-term prednisone for rabbits with mediastinal masses. 6 rabbits, not a huge study, but it's a start, that had these mediastinal masses. And we saw, I think the range was 2.5 months, not great, to 30.8 months, which is good, and that all the time being on steroids. So, and a majority of them were over a year with mediastinal masses on steroids. So it's something that it needs a conversation with your veterinarian as far as whether, ask your doctor if steroids are right for you. But it's something that is at least we're getting more brave about using it long term when indicated. But what's new? What are we doing? We've done that. We've been there. I want to know what do I have that we can kind of say, wow, that's cool. Electrochemotherapy. So this is taken from the human side of things. Chemotherapy drugs are bad. They not only cause destruction of the cancer, but also any rapid dividing cells like your blood or your intestinal lining, things like that. So typically we would give chemotherapy systemically, right? We inject it into a vein, it circulates and kind of tries to go to those rapid dividing cells and kill the cancer. But we have to give pretty high doses to be able to get all the cancer. What if we use microdoses and we actually inject the tumor itself? So what would happen is the tumor wouldn't absorb the chemotherapy, and the tumor would say, yeah, nice try, but I'm still going to grow and cause problems. So we kind of developed, I had nothing to do with this, they developed this procedure called electroporation, where they inject small currents into the tumor itself, which opens up the cell walls of the tumor cells and allows that chemotherapy to get into the cell. They stop the current, the cell walls close, and then the chemotherapies do their thing at the tumor site. Now, this won't work for lymphoma. It won't work for diffuse cancer that's in the lungs and spread throughout the body. This only works for tumors that you can actually get to with these things to make it work. So fibrosarcomas in rabbits, these are ones that are usually kind of firm and nodular anywhere on the skin, very invasive locally, so surgery almost, unless it's on the end of a limb and you can amputate or something like that to get clean margins, it's really tough to get clean margins on them. So this is something that they've done in rabbits and have had, at least initially, some promising results with. So again, something that's new. Yeah, so fibrosarcomas is where we've seen, and those are the only places I've seen it work. They're doing it in dogs and cats as well, but it's usually solitary, locally aggressive tumors. All right. Pododermatitis, right? So I try to scale back on, if you just do a web search for pododermatitis in rabbits, there's some pretty horrific images that are out there. And this one, yeah, that's a problem, but it can get much, much worse than that, right? And hopefully you haven't really seen how bad it can get. This is not one that I would call a common disease, and it wouldn't be one that I would shout out if someone said, name the 3 common diseases or common conditions in rabbits. This is not one that I would say. We used to see a lot of it when they were kept on, wire bottom cages and fed horrible diets and were overweight, but we don't see it as much anymore. But it's still there, and I want to show a case, like I said, that I had just a little bit recently. As we know, these are extremely painful, so even with the pain medications that we do, it's really hard to manage pain for these guys. We, it's a horrible thing to have to do. So, what do we do in the past? We, here comes Cut It Out Ken. When there's a chance to cut, there's a chance to cure. So we go in and we do some pretty aggressive surgical debridement, bandaging. We would put them on, long-term antibiotics, and okay. I mean, we could manage them, but they were never cured. Sometimes it would be so painful we would, we'd have to euthanize. Sometimes we'd have to amputate just because of how bad these were. What works in the past? Prevention, right? So keep your rabbits nice and lean, keep them on a good diet, not carrot. Keep them, their environment cleans and things like that will work. But occasionally, we get cases where that wasn't provided and now we're playing catch up. And I have a couple of rabbits that I've done medicinal maggots. Yes, here's our time where we talk about maggots. And these little guys, they're so cute at that age, right? So again, maggot therapy is not new. I mean, it's been around for a really long time. It's just our queasiness or our comfort level with this treatment, right? We can think about how it would feel to have maggots kind of crawling under your skin, and we don't think that would feel very good. But I will say, there's one lab that's licensed to sell medicinal maggots. It's right here in California. It's called Monarch Labs, and it's the only place where you can get these. And this is a prescription. It's regulated by the FDA. These are sterile, so they can't reproduce. They can't infest your house. They only eat dead tissue, so it's not going to be like, oh, I left maggots in too long and now I have a skeleton. It's this is something that these little critters go in and they basically are able to get where we cannot. And they don't, I can't control my scalpel to be able to get just the infected and not the healthy tissue. I usually have to go for, until I get to healthy tissue, which means involving getting some of that healthy tissue. These guys, they go in and they do an amazing job. So it's maybe takes a little bit of and it's not just you guys, it's the veterinarians, so my associates, I tell them I'm doing medicinal maggots and it's like, oh my God, that's disgusting, that's gross. So it takes a little bit to overcome, but I want to, I want to share, so this is Luna. She was a breeder rabbit that had abscesses on all 4 feet. And this is Katya. She's a technician who's an amazing technician and going off to vet school probably, which is what happens to a lot of our big technicians, unfortunately. But she adopted Luna, or rescued Luna, and had multiple surgeries, multiple debridement, long-term antibiotics, and was doing, couldn't really walk, just kind of, stayed there and I would say lived kind of in pain long term. So she came to me and said, and actually this is how I found her as a technician, because she came to me with Luna and said, what can we do? And I told her about maggots, and she was right on board. She's going to be a great vet sometime. So we ordered the maggots. We treated all 4 feet, and we got resolution on 3 of the 4. There was one that was kind of persistent, but it was 90% better. We ended up running into other problems with Luna, with other, she was a chronic regurgitator, and we were dealing with esophagus with her. But as far as her feet, she had 8 months of pain-free, I would say. I mean, she was binkying, so she was obviously doing, feeling quite a bit better than she had for a long time. And I don't know how I would have achieved that without the help of Maggot. So I just, again, it's something that we've done for a long time. It's something they use in human medicine as well. If you go to the Monarch Labs website, you can look at videos and read about it and why, kind of overcome that fear that it's not something that really causes people much discomfort. So I can imagine that, rabbits being way more tolerant than we are, do quite well with it. And I've had 2 rabbits that have done well.
Just a quick question. At what point do you remove the maggots?
Yes, yeah, what happens at the end when they're done eating, right? That's a great question. So the way that these guys come is in a sterile vial, and they're itty bitty. You take them out, you pack the wound, and then you put some form, usually it's like gauze followed by pantyhose, if they're on the foot, and then you wrap that so that they can breathe, because you can't just wrap them out. And then you have them come back in 3 days. You take the pantyhose off, and you just you basically pick out the maggots, which are much bigger after feeding their dead tissue. So and sometimes it may take a couple of times, so you would have to go in and do this multiple times. It does get a little, so cost of this therapy, we pay, I believe it's $200 for a vial of 200 little maggots, and then it's $50 shipping because they have to send it overnight. And we don't, that's the charge we charge. We don't mark it up at all. But if you have to do that multiple times, it can add up, because you can't keep the maggots that you don't use because they're either dying or growing, and then by the time you're ready to do the second treatment, they're too big to use. You have to get the small little guys for it to be effective. So again, it's something that's out there that I think it will take a little bit to overcome the grossness, but there's definitely some benefit that's there that I think will help some of these guys with severe abscesses of the feet. All right, so how's everybody doing out there? Am I the only one suffering? Yeah. Feet. So I've only used it on feet. I've never used it anywhere else. I mean, we've definitely had those rabbits that have had some crazy abscesses with that liquid pus that's kind of going between tissue layers and things like that. I've never used maggots on that. I've always kind of reserved it for feet, but certainly possible. I would think there's probably other uses of that out there. I heard somebody. Yes, sorry. Yes. So the question was, I should repeat the question because I noticed when I was sitting in the back yesterday, I didn't hear any of the questions. But the question was, is this a specific breed? Yes. What breed is it? I have no idea. So it's one that is, again, it's regulated and licensed by the FDA. There's only one institution that can sell it, and it's a sterile certain species of fly larva that they use. 3:30. Okay, 3 minutes. All right. So the speed of progress. I threw this slide in here because I wanted, sometimes it can be frustrating as far as how slow medicine moves. And, why can't we just, figure out what works, do it, and be done with it, and keep moving forward. This is a little, I don't know if you can read it in the back, but it basically is a little rabbit doctor with a sloth patient that says, you were in a coma for 2 years. And he rolls over and says, just 5 more minutes. That's me this morning. But that's, it's frustratingly slow for a reason, right? So we, especially in this day and age of fake news, we want to be able to trust results. We want to make sure that what we're doing is helping and recognizing the risks that are involved with these treatments, and we can't just, just kind of move forward without really looking and assessing, what's working. And we know that we all have biases, right? We can't get away from that. And it's, what do we do with that information, and how do we prevent it from affecting the results? And so, we do things like, we do a blinded study. That's, we don't literally blind ourselves, but we we have a treatment group and we have a control group, and we don't, we're using, say, drug A to treat the treatment, but we don't know what drug, what group is getting the treatment and what group is getting a placebo, which looks like the treatment to, to the rabbit and to us, but it's not the actual drug. And so that allows us to kind of, take one step removed from those biases. So we're, typically, pain meds as an example, in humans, it has about a 50% placebo rate. So if you take something that has nothing to do with controlling pain, and you believe it's controlling your pain, it will control your pain. And that works with maybe not rabbits in their mind, but it works with us that are, we're doing something, we want to see a result. And so we can look at that and say, oh yeah, look at now we're more active. I think I just saw him stand up on his hind feet. This must be working. We're doing well. Not always. So when we're doing stuff that we're trying to promote and trying to grow as far as veterinary medicine, we want to make sure we're not spreading, poor information. So to do that, we blind ourselves. We even double blind ourselves, where the people that are assessing the numbers, are crunching the numbers, don't know which are the treatment group, which are the control group. So again, because we tend to want to fudge things, we tend to want to round up, and we want to see, we want to see that response. So it takes time, it takes money, it takes patience. It takes patience. So like we need the numbers to know. And when we think historically of research, especially rabbits in research, it kind of brings back bad memories because the way we did things. We're changing a lot of that. So, there are animal care and use committees when universities are applying to do research, and they have to keep in mind the well-being of the research subjects, which is good. We want that, but that it takes time. We can't just subject these guys and record things. We have to make sure we're keeping their well-being into consideration. And again, it takes a lot of time, and so we have to appreciate that we're going slow for good reasons, and we're moving. I mean, we talked about quite a few of those things that where we've gone, and we're still trying, and we know we have a ways to go. But as long as we keep trying and we keep improving, we're doing right. But there is a right and a wrong way to to move forward, and I think moving forward just based on unsound medicine and testimonials of that people trying to sell you products is not the way to go. All right, we've reached the point where we're going to talk about
I have a question about clinical trials in veterinary medicine. Is there a website or something where you say, oh, my rabbit has this, when clinical trials are available, like human beings?
Right. Yeah, they do, and I think so I don't know of any. I think it's a great thing to look to as far as opening up research to allow us to be able to see what results are, good or bad. Opening up the clinical trial, so if you have maybe a rare disease or something like that with a rabbit, that you can kind of enter into a study. There's certainly cancer in dogs and cats. We have a lot of that stuff going on. There's a lot of money that's behind that to kind of help fund those kind of studies. We don't really have it in rabbits, and so I think that'll be something that will actually help medicine, veterinary medicine, human medicine. The more transparent we are, the more everybody can look at those results and kind of come up with their conclusions. I think the better we grow. So vet school websites, yeah. So that's true. So there's that I think as far as like the cancer studies and stuff like that, usually they'll list everything that they're doing, and so you can kind of see if there's something there that you can help out with. All right, how's everybody doing? Do we need to stretch or anything? This is a long time. All right, we're going to keep going with EC. So we learned a little bit about this yesterday. This is a frustrating thing because it's hard to confirm. These are bunnies that all have at least 50 to 70% of them will test positive to the antibodies without knowing if that's causing the disease or not. So usually you need a necropsy or a piece of brain or that sort of thing, or an eyeball lens to confirm it. So it's hard to say, yes, that's what's causing the neuroelectric signs. It's very prevalent in rabbits that are out there. It has a lot of varying clinical signs, right? So we talk about rabbits with cataracts, and we talk about rabbits with urinary incontinence and hind end weakness and seizures and head tilt and rolling and all that kind of stuff. And so here's a disease that we have a hard time confirming it. It's very prevalent and shows a lot of different clinical signs. So it gets blamed for everything, right? I can't be wrong, it's EC. It's got a head tilt, so it has to be EC. But that's not true. It's just easy to blame because we don't have, we have these limitations that make it hard. So we talked a lot yesterday with that, and I kind of wanted to dive a little bit deeper into what EC is, and maybe kind of show you, why it's difficult to recognize and treat. And so we're going to start with just kind of the boring life cycle, which actually I think is quite interesting. This kind of stuff is interesting. So it's classified as a microsporidian parasite. So with a worldwide distribution, it's everywhere, right? So this means it's an obligate intracellular fungus. So that's where it's ended up in its classification. That's kind of unique. We don't see a lot of these out there. We used to think it was a little protozoal single cell organism, but now we've kind of limited it with with the knowledge that we have now, and it's kind of stayed in this class for quite some time, and I think it's settled in. They always tend to change some of this stuff on us, but it's been there for a few years now, and I think it's going to stay. So microsporidian parasite with worldwide distribution. It has horizontal and vertical transmission. So we know that does will pass it to their kids transplacentally, and that's called vertical transmission, one generation to the next. And then we also know that they can shed the spores in the urine, and a naive rabbit that has not been exposed to it can then contract it that way as well. The spores are shed in the urine for 1 to 3 months, so it's a kind of a short term as far as when they're actually shedding the spores. You can actually, if you're lucky, you can actually catch the spores in the urine, but usually by the time they're showing clinical signs, they're not shedding. There's some that think that they're intermittent shedders throughout their life. We still don't quite know if that's true or not, but we do know that the spores can usually survive for about 6 weeks outside of the host. So that's how these things are spread around. So initially, when the rabbit is exposed to the organism, regardless of which transmission takes place, they like to go to highly vascular organs. So kidneys, lung, liver, places like that, and that's where they kind of set up shop. And what they do is these little spores have, it's called a polar tubule that they shoot out and lodge into the host cell, inject a bunch of goo in there that has stuff to kind of make more DNA and create more spores, and it's encapsulated to prevent the host cell from causing much damage to it. So that's the primary way that it will actually infect the host cell. There's also phagocytosis where the immune system says, oh, you're not welcome here, I'm going to eat you, and then they eat this spore, and then they do the same thing. They shoot that little polar tubule out and inject stuff to kind of cause replication. Eventually that cell will rupture and release lots of other spores that go and kind of pass along their DNA and create more spores. So that's typically how how that cascade or that life cycle is. But it means more when you can actually see it, right? So hopefully this video will play. If you look at the little red circles and then you see the little polar tubule shoot out, I mean, how cool is that? That's what's happening. And one of the things that they're looking at is, what if that's their primary mode of infecting? What can we do to stop that? What can we do to kind of take away those little tubules to prevent transmission? And there's some thought that that is made up of chitin, which is unique to fungus, and so maybe if we put them on something to kind of take away that, but we're still kind of in the beginning of it. I will say these are not EC, it's another spore, but this shows attachment. Slow motion, yes, excellent. So the polar tubule shoots out, basically embeds. Now that would be a host cell, not another of its same organism, and that's how it attaches and injects its stuff to continue the cycle. But that's pretty neat, and I think if we can, it allows us to say, what can we do to come at this a little bit differently to stop the spread. So what we see when we start seeing clinical signs is usually later in life, right? So typically, they go to the kidney, the lung, the liver, the highly vascular organisms or organs initially, and they either get shed in the urine and kind of propagate or perpetuate. But what do we see? We see, urinary incontinence. So when they cause enough kidney destruction to limit kidney function. We see cataracts. And how does that happen? So this is usually the young rabbits, and the thought is these rabbits were exposed transplacentally. They were exposed by the doe during the formation of the lens. The EC organisms got into the lens and kind of formed these juvenile cataracts to form. And a lot of that's based on we've seen them in the lens. So we've seen them and we said, aha, we know they cause a problem. Usually, juvenile cataracts, I don't treat with anything because I don't think anything slows the progression of the cataract. And I don't see those guys go on to develop other signs like neurologic signs. I think a lot of times it will develop into bilateral cataracts, so you may see lens luxation or some things like that. But I don't immediately, if I see cataracts formed in young rabbits, I don't immediately start the EC treatment. I say, well, at least it's not the neurologic form. I think you guys have a better chance of not developing problems with neurodisease. And that's the other part is the brain. So this is the organ where we see most of the severe clinical signs. These are the rabbits that were completely normal and now are standing on their head or rolling. And those can be a little bit disconcerting. So diagnostics, we have to rule out other causes. Again, we tend to blame this for a lot of things, but there's other reasons we are neurologic, and it could be middle or inner ear. It could be meningitis or infection, inflammation of the covering of the brain. Toxoplasmosis, Bacillus ascaris, or infectious organism that cause neurologic signs. Aberrant cuticuli migration. We had a really bad year of cuticuli this year. They tend to kind of cycle through, but we've had ones that usually they are in the skin. They have to have their little breathing hole, and you pop them out, and they're very gratifying. But occasionally they end up in tissue like the brain, and can cause some neurologic signs. And unfortunately, there's not a whole lot you can do to get those ones out. So in the past, or now, I guess this is relatively recent. We test for antibodies. This is why we can't really say if it's active disease versus exposure, right? So there's antigens, which are the proteins of the organism causing the problem, that we can't really detect. We don't have that ability. So what we look for is antibody response. So your body, makes these antibodies to fight off these infections. Can we see these and can we measure them? And the answer is yes, we can. And there's two types of antibodies that we can see in these guys. One is the IgM, which is kind of the quick response. So that's the body's response. That you'll see these rise with recent infections, and then the long-term immunity is usually your IgG antibodies. So we've gotten really good at testing what are called titers, so the level of these. And we see that, in rabbits, we can, see these 5, 10, 50-fold increases in their titer that would suggest that maybe there is an active infection going on. Especially if you see IgG and IgM elevated, it would suggest there's a possible active infection. And then we've also, as mentioned yesterday, we've kind of looked at what are called acute phase proteins. So this is where, sorry, Pat? Don't you have to have a baseline? You don't. So one of the things that we're looking at is rising titers. So if you see a rising titer, maybe there's, that's why it's rising, is because there's something still happening that's there. But you don't need a base to get a titer. So they have normal ranges, and they say if it's over this range, that's consistent with a positive with that. So comparison is important, and it gives you information, but you don't need it to confirm with that. So acute phase proteins are these proteins that are released with active inflammation, and they usually spike and then drop. So we're looking at these to see, just as another marker to say, again, is this active infection, or is this related to, I was exposed like 50 to 70% of other rabbits to EC, and I just have antibodies to it. So C-reactive protein is the one that's being tested. They're looking at a lot of others like serum amyloid A. This is work that's being done by Carolyn Cray. She presented as well this year, and she is the person to go to, and the University of Miami. So there's other labs that are testing for EC. I would say go to where they're doing the most amount of work. She's been doing this for over 10 years and is the authority on rabbit EC, and she's not giving up. She's continuing to look for ways to find this and to know that it's what's causing disease. And so I would say all of your samples should go to her. And she's currently doing a study now where she's calling it the Cuniculi panel to opt into it, where they'll look for IgG, IgM, C-reactive protein, but they're going to look for a ton of other acute phase proteins. And if you opt in, it's no cost to you, but you're allowing her to use that sample to get more numbers to be able to find out how many of these guys are actually positive. I had one a couple weeks ago. We did a test. We were positive IgG, positive IgM, 10-fold increase in the C-reactive protein. Right now, the results when that gets sent to me, it says there's a positive predictive value of that result, that 92 to 100% of that is an active EC infection, or there's an active EC. Now, whether that's causing the clinical signs, it's hard to say, but we're getting more and more information, and this is one that is this is where we're getting it from. And I do encourage us to test more. This is one that I kind of backed away from because how valuable is a test that they're all coming back positive? They're all coming back positive because we're testing the neurologic guys, and there it's about 70%, so it's not all. I have seen some people say, well, all the rabbits in North America test positive for EC. I don't think that's backed up by actual numbers. I mean, these numbers of 50 to 70% are coming from this lab that is the authority of testing for the disease. And it's 50% of the rabbits that have no clinical signs will test positive, and about 70% of the ones that are actually having neurologic signs will test positive. So there is a value in testing, not only to get these numbers and get better tests, better ways to find out, but also to not write off these guys that are negative. So if you have a neurologic rabbit and you say, oh, I'm not going to test for EC because it looks like EC, and let's just go with that treatment, it's going to be one that tests back negative, and you're going to say, okay, well, if it's not EC, there's a lot of value to that, and let's look at what other things, let's do a CT and find out what's happening there. But the latest and greatest with this is they're trying to develop a point of care test, which means something you can do in the hospital using these acute phase proteins that are specific for EC that will allow us to be able to tell you within 10 minutes, whether or not EC is likely or not. So that's where the opt-in to the Cuniculi panel is going to be helpful and get some more of these, more of these numbers behind us. 10 minutes, all right. So this is, we kind of covered a lot of this. So, I'll touch on it briefly, but, we need to take care of their rest of the bounty here. So we need to make sure their gut is moving and make sure they're hydrated. We need to, typically, as far as medications that are out there, so Malocclusion, our good friend that we use quite a bit in these guys, there's thought that a lot of the clinical signs may not be related to the bursting of the cell when they get so many spores in them, but the inflammation that's associated with that. And so if we can get them on some anti-inflammatories, sometimes we can control or reduce some of those neurologic signs. Anti-nausea meds, so the Dramamine, the Meclizine, so some of these guys that are just, their eyes are constantly moving, they're rolling, and they just, we want to get them on something to kind of help control that nausea to improve their appetite. We'll use some Meclizine with those. Sedatives, so, again, these guys that, at least initially when they present, and they're rolling and rolling and rolling, and you're towel propping them, and you just want to give them some break. Sometimes putting them on something to help sedate them and relax them will help these guys out in the short term with that. And then the fenbendazole, we talked about this yesterday, the 20 mgs once a day for 30 days, that, there's some people that don't use this, and some smart people that don't use this. I'm not one of them. I feel like, back in the day, we used to think it as a very safe drug, and we'd have rabbits on it for 6 months. We then realized that, it can cause severe bone marrow suppression and death, especially as you go after that 14-day mark. There's a little bit more risk that's involved. So it's not a benign drug, but I don't think I think the incidence or the likelihood of bone marrow suppression is still fairly low. It just needs to be a concern that needs to be addressed, and know that it's not a benign drug. And it's the only one that has actually shown to actually kill EC during actual research infection or stop the progression of EC. So I will never say that this is a cured disease. I mean, there's just no way for us to cure them. But as far as preventing infection, fenbendazole is the drug that has, in a research setting, has shown to stop that. So that's our mainstay. Some people use steroids. I typically don't for this one. I'll go with the nonsteroidals, and I'll go with the higher doses of nonsteroidals. But is it wrong? I don't know. I guess it depends on how the rabbit does. I will say I mentioned steroids a couple of times, and rabbits being steroid sensitive, but there's indications sometimes to use it. Never use Malocclusion and a steroid together. So if somebody is prescribing that, you say, well, let's try a steroid. Don't go home and say, oh, you're painful, let me give you some Malocclusion. That's never good for these guys. So just know that as a caution. So these are the clients that will call in hysteria, and even some vets too. Where, if you've never seen this before, it's terrifying. You pretty much convince yourself that your buddy is dying, and sometimes you're rushing to the emergency to euthanize your rabbit, and so it's a big part of it is talking them down a little bit and saying, yes, this is serious, and yes, it's hard watching a rabbit be like this, but it's most of these in 5 to 7 days will do quite well. You just have to do some pretty aggressive nursing care and supportive care. But if you can hold out, these guys will typically. I don't have any numbers for you, but I would say probably 80% or more will do quite well. I tell people that the residual head tilt is especially if it's pretty severe, is most likely going to stick around. We have to protect that down eye and make sure we can get in and out of the litter box and those kind of things. But a lot of times that head tilt will persist. And then EC is one of those ones, again, we never talk about a cure, we just talk about kind of remission. And we know that stressful events, whether that be an illness or anxiety related, can sometimes cause these guys that have had no clinical signs for years to all of a sudden start showing signs again. That's all I have. And I have one more thing to add, so hang in there. It's hopefully something, I think most of you may have seen it. It's a commercial from 2006, and it's something that I think kind of sums up this topic, and with a little bit of humor. So I want to try to play this for you to end my whole thing. That's not it. It's a little bit sensitive. It's taking a while to load, so I apologize. if I could sing, I would entertain you. Anybody know any good jokes? So I had my tooth pulled.
This is Maggot, our first successful reattachment. In recent months, we've been able to reattach thousands of lucky rabbits' feet to their original owners. It seems silly now, but for generations, people actually depended on these for luck.
Thankfully, people everywhere have realized that you don't need luck as long as you've got the right insurance. Insurance that stays in sync with your risks.
Sure, there were setbacks early on.
Too lucky. But now rabbits like this can lead full and productive lives.
We won't rest until every foot is returned to its rightful owner. Together, we can make a difference.
Thank you, science. Thank you, Travelers Insurance. Thank you, baby.
Travelers. Insurance in sync.
All right, thanks guys. Thanks for inviting me and thanks for this great conference.